Hello, this is Sepchun Bernard. The subject of death sometimes brings an unsettling thought into our minds. Yet it is fascinating and catches our attention. This is likely because we are going to eventually face death as it is inescapable. Also, there is an unknown, a mystery as to what will happen after we die. Let us talk about death and why we should not fear it when we are prepared and when death comes knocking on our door. I work as an RN in the hospital in bedside care for the critically ill and on numerous occasions have witnessed patients dying before my eyes. One of the very first times I was a neophyte as an RN in an intermediate care unit where the patient was hooked up on telemetry and her cardiac rhythm was monitored from another room. The female patient was an end-stage cardiac patient who was already placed in hospice. Somehow, she landed back in the hospital for care to sustain her heart. Her family, with husband, children, and relatives, were around her. She was restless and has been trying and getting out of bed to walk about and at risk for fall. She may have been in a state of psychosis or delirium. Family has been calling for some medications to calm her. I gave her the Haldol drug prescribed by her treating MD, 0.5 milligrams IV, and it did its job. This dose was significantly lower than the recommended dose for a healthy patient. And within less than 2 hours, the telemetry monitor called to inform me that the cardiac rhythm has started to slow down. I was on edge, for as a hospital nurse, our main goal is to stabilize the patient, to get well and discharge the patient from the hospital. This time, I ended up holding hands with the patient's husband and the others in the room, praying for the patient as she was outbound into the spirit world. Well, thankfully, her husband was very grateful, for she is finally at rest, a hospice patient. My heart, however, was in the pits, and my mind was racing. I thought I was going nuts. Dealing with death as an RN was something new and was not prepared. I had not developed the coping mechanism yet. For days, I struggled with the trauma, turning to my colleagues who assured me that it was her time. There were many encounters of death working in the hospital. The point to be learned is that death comes. But we do not want to be surprised. We see this side of the world, but can only imagine what is on the other side of the world. An analogy may be a baby coming out of the birth canal. It is delivered from the peaceful and protected amniotic fluids in the womb, and then it comes out into the open, into our sometimes cruel world, after which it is being cut off from the oxygen and the nutrient supplies received from the umbilical cord. Some cries out loudly to take in the deep breaths for oxygen into its now functioning lungs. The body's mechanism all start to work for breathing and feeding so as to adapt and survive our world. But what about our souls? We have so many near-death experience stories online. Some tell of heaven, some tell of hell. When we die, our souls break away from our physical body into the spiritual world. Certainly we will face the Creator and be accountable for our earthly lives. Are our names written in the book of life? We should read Revelation chapter 20, verse 11 to 15 at least, about the final judgment. We need to follow the teachings of Yeshua, who created us, if we want to be in the book of life. If some things or something that this is a fairy tale, then ask why. There is this harsh reality of death, and why Yeshua died on the cross. Even the Eucharist he left behind for us contains his cardiac and blood cells, which are proofs of his divinity. These signs are left for us so that we can believe in him. I encourage you, explore and live well the gospel life. In this way, we will not fear death. God bless.